Mamas, is your baby breastfed? If they are, I want to talk about some of the reasons that commonly bring babies to the emergency room. Hi, I'm Gwen, a pediatric emergency nurse and mom of two. Today we're going to talk about hyperbilirubinemia, which I know is a really long word and often is referred to as neonatal jaundice. This happens in the first few days of life when mom's breast milk is still coming in and the baby gets a little dehydrated, so they have trouble breaking down their red blood cells in their body, and it often gets corrected once they get hydrated. Oftentimes, if it does take a little while for your milk to come in, then hospitals may recommend supplementing with formula in the meantime. This can be devastating to hear. When I heard it for the first time, I didn't want to listen, and I was very upset that I wasn't providing what my child needed. And while it feels like that's the case, the hospital is really just trying to get your baby what their body needs. And for mamas, especially first-time moms, it does sometimes take your body a few days to get your milk in. And that's okay. It doesn't mean you're not good enough. You are a good mom and you're worthy of that baby. If you are okay with supplementing, it usually does get you out of the hospital a little bit sooner. Now, some babies with hyperbilirubinemia do need phototherapy because that helps them break down those red blood cells and lower that bilirubin level. I have had two babies, and both of mine have had jaundice and have needed to be admitted to the hospital because of it. My son was a premature baby, so he was in the NICU with it. And my daughter was having trouble because she had torticollis, so her neck was a little tight on one side, so she had trouble transferring the milk, and because of that was a little dehydrated and had to get admitted. Check out part 2 for more about hyperbilirubinemia.